This is my presentation on health promotion. So what is health promotion? The definition of health promotion on the World Health Organization's website is that health promotion is the process of enabling people to increase control over and to improve their health. The aim is to help individuals and communities to improve overall health and well-being. The importance of health promotion is that it can reduce the spread of disease and illness, has an impact on lower crime levels, and lowers costs to the NHS and increases vaccines uptake. For example, with health promotion tackling obesity, they can actually help stop obesity-related diseases. Obesity cost the NHS 5.1 billion in 2007. This is more costly than alcohol and smoking. Health promotion is important to try and tackle this and get the NHS costs down. For example, in 2018, there was a sugar tax levy that was introduced. It charges a levy on manufacturers producing drinks with a high amount of sugar in, and so these drinks now cost more. After this was added to the price of these sugary drinks, a study led by the University of Cambridge estimated that the daily consumption of sugar actually fell by 5 grams per day for children and 11 grams for adults because of the levy. So this is the importance of health promotion, because then these people, we can actually stop obesity and it is a preventable disease. Therefore, with health promotion and having less people less affected by it, then the NHS costs reduce and they can focus on diseases that are actually non-preventable. There are a few different models for health promotion which help people, first of all, in health promotion, decide the campaign, and it also, a lot of them look at how behavior change actually happens. So there are a few different models. Let's start with the social ecological model of health. The ecological model believes that behavior is influenced by many different factors, not just personal ones. Let me just zoom in here. So culture, policies, community organizations, interpersonal and individual. It actually looks at the broader picture of where people can be influenced from. This model actually takes a holistic approach by looking at the entire picture. This model helps health professionals design effective health promotion programs by using multiple different levels of influence. An example would be who you hang out with. Your social circle could actually support your habit of smoking. For example, if all your friends smoke, it will be harder for you to stop. However, if you're the only person who smokes, you actually may find it a bit easier as no one else around you is doing this. Next, let's look at the health promotion model. This model was created by Nola Pender, and at its core, it's not actually about preventing illnesses, but it's focused on making people have a higher level of health and well-being. Instead of fixing someone who's already sick, it encourages people to actually increase their own health and well-being. It works alongside models that prevent disease and illnesses best. This model wants people to be active in their own healthy life choices and acknowledges that their environment can impact this. A key part of this model is that it's a lot about an individual's own belief if they can succeed, and they call this self-efficacy. For example, if someone believes they can succeed in quitting smoking, they are more likely to actually act on that change. Next is the health belief model. The health belief model is actually one of the most used models looking at health-related behaviours. At its core, it's about if a person believes that it is worth changing their behaviour to prevent an illness. It proposes that people are more likely to change their behaviour if they are at risk of a health issue or the health problem they have has a bad outcome. This person has to believe that taking action will actually help them. This model could help this person make their decision. It helps identify barriers to their behaviour change. Perceived severity is how serious someone believes their actions are. For example, if someone is a smoker and they actually believe they will get lung cancer, then they are more likely to change their behavior. For example, a younger person who's maybe only smoked for a few years, maybe doesn't see the future and how badly their body can be being affected by smoking, and then they're less likely to change because they don't fear that it's that severe. However, if someone is in their late 60s and they're already having multiple health problems that are related to smoking, they will then see the risk much higher and actually be more likely to change their actions. Next, let's move on to the stages of change model. So this actually has 6 stages, and it looks at behavior change as a whole process. So at the start is the pre-contemplation stage. This is the first stage, and there is no change happening in this stage. The person is not looking at changing any of their health habits, and if someone suggests they do, they will actually dismiss it. They will not recognize their behavior as a problem at this stage. Next is the contemplation stage. This is when the person first starts to look at their problems and acknowledge that there is an issue and that they should change. However, no commitment or plan has been made at this time. Preparation. This is the next stage. At this stage, a person wants to act and maybe beginning to start researching, talking to their friends and family, talking to a health professional on how they can make the change. They are starting to explore options, and that could improve their health. Next is the action stage. At this stage, this person would have started setting up a plan and changing their behavior. They will have a strategy, and they will have perhaps health professionals or an NHS app to help them. They are committing time and energy at this point to change their behavior. After this is the maintenance stage. This can actually be most difficult for most individuals. They have maintained their behavior change for a while, but they have to try not to relapse at this stage and go back to their old habits. Lastly is the relapse or termination stage. This is included as part of the cycle, as people do often return to their old behavior. People can still re-enter the cycle again at any stage. And for example, if they're at the relapse stage, they can then go back to the preparation stage and start again. Failure is part of behavior change, and it shouldn't make the person feel bad. They can keep trying again. Next, I'm going to compare 2 different of these models. I'm going to compare the health belief model and the stages of change model, which I just spoke about. At their core, health belief model looks at the risk and benefits for the individual and the why someone decides to change their behavior. Whereas the stages of change model looks at more about how this person is going to implement their changes in their life. So there is similarities between the two. Both consider the psychological reasons behind motivation and behavior change. The health belief model looks at the risk and benefits for the individual, and the stages of change looks more about when the person is ready to make that change and how they do so. Both are focused on the individual at the core of the model. They do not look at environmental factors such as housing, what the person's job is, the family around them. They are looking at the individual. They both believe that behavior change is a choice and is intentional by that person, and it doesn't automatically happen. There are some key differences between the two, however. The health belief model, as I've said, looks closely at looking at the why. Why would someone choose to change their behavior at this time? Whereas the stages of change model looks at how. The health belief model doesn't assume that behavior change is already happening. Instead, it looks closely at that person's perceived risk. For example, skin cancer. If a person spends a lot of time in the sun, their perceived risk of skin cancer is a lot higher than someone who doesn't. And they are more likely to then change their behavior, as opposed to someone who isn't in the sun a lot, so therefore doesn't think they have a high risk. However, it's not actually about the real risk of skin cancer. It's just what the person believes. The stages of model or changes model doesn't actually bring risk into the equation, and already assumes that someone's already on the behavior change process somewhere in those 6 stages. Another key difference is actually the structure of the model. So the 6 stages of change model has 6 different stages and kind of is in a linear process, whereas the health belief model does have 6 different events. However, they don't happen all at once, and some person may only do one of them, whereas another person may have a few. Next, I am going to look at the strengths and weaknesses of the health belief model. So the strengths of the health belief model is that it encourages preventative health behaviors such as sunscreen, exercise, healthy eating. And this makes the H belief model actually beneficial, as it targets preventable diseases by early actions. It also helps health professionals tailor interventions to a person's needs. For example, if they can see that person, it helps them as it makes the interventions that the health professional decides to do for that person more targeted to what that individual needs. It is also widely used in many different health campaigns, such as vaccines, smoking, skin cancer, and successfully. So it doesn't just focus on one part of health, which is good. It is a wide-ranging model for people. There is some limits, and one of the big arguments is that the model simplifies behavior and doesn't take into account cultural and social influences on people's health, and it kind of looks quite just at the individual. A criticism is that it can make a decision look at very static and very limited, ignoring how complex someone's behavior can actually be. For example, it doesn't look at cultural influences, the person's environment, if that person is employed, unemployed, their housing. It doesn't look at how big of an impact all of that makes on behavior. People's emotions can also have a big involvement in their behavior, and they do not talk about this. This is opposed to other models that actually do include those other factors. So therefore, I think the health belief model can be used best in line with another model that does look at those factors. It also doesn't consider relapse as part of the behavior change, which is a very common part of behavior change. It simplifies it too much and doesn't consider that the person could actually relapse and have to start again. The stage is a change model. So there are strengths and weaknesses for this. One of the strongest part of this model is that it acknowledges that behavior change is not a simple process, and a person can skip a stage, relapse, be on relapse for a while, be in the pre-confrontation stage for a while. So it does acknowledge that behavior change is not very simple. It acknowledges that it takes time and it can happen over and over again. And this is helpful for health promotion, as it doesn't put pressure on the individual to get everything right first time and to succeed. It allows relapse and it allows failure. And then a health professional can actually help the person keep going. It also helps the health professional tailor advice to the individual. For example, if a doctor recognizes that someone is ready to implement a change in weight loss, but they're just at the pre-confrontation stage, they will just focus on giving them the information. Whereas if they're in the action stage, they can start helping, giving them exercise plans, food plans. They can tailor that advice to the person to see where they are in that stage, and then it will have the most impact, because there is no point giving someone an exercise plan if they're only in the early stages of change, like the pre-confrontation stage, and they are not ready to actually put things into action. And this can help them with long-term change. There is weaknesses with this stage. So the high success rate of this model is mostly changing on one behavior at a time. Researchers have tried to use this model to change multiple behaviors at once, however, have been less successful. Only 1 out of 39 studies that have tried to change 3 or more behaviors at the time were successful. This could be, though, that they're at different stages. For example, if someone's trying to quit drinking and also lose weight, they could be at that action stage for drinking, but at the pre-confrontation stage for weight loss. Therefore, they're at different stages, so the process is not going to be the same, and it's harder to change them at the same time. Another limit is that human behavior isn't linear and isn't perfect and won't always follow the exact 6 stages. It's also quite rigid and keeps people in these 6 stages where other things could happen to someone. It is complex and is influenced by a lot of different things, not just the individual itself. It's influenced by their job, influenced by their environment, and it doesn't include that. So that is a negative of the model. So for my campaign that I chose the Better Health Every Mind Matters campaign. The Better Health is a health promotion by the UK government, and the Every Mind Matters is the mental health part of this campaign. So it was introduced by NHS England in 2019 and helps adults and young adults look after their mental health. It offers online advice about anxiety, depression, and stress. Along with this, it also has a personalized quiz, which then gives you a My Mind Plan tool, which you can access on your phone or online, which gives you personalized advice. This can be sleeping tips, CBT therapy, and other information techniques, and also how to meditate. It offers free advice to the user and is easily accessible, being online or on an app. The target audience is for adults in the UK, and it aims for the individual to look after their own mental health well-being. It is designed mostly for people that have mild mental health issues and on promoting positive mental health changes, such as improving someone's sleep and just helping them have less anxiety. This is a health promotion initiative as it focuses on prevention for mental health problems, but also empowers individuals to actually make changes in their own lives. The UK government found that 57% of people who did experience mental health problems turned to unhealthy behaviours such as smoking or drinking, whereas this is trying to encourage healthy behaviours that could help them. It is trying to use preventative measures before people turn to those behaviours. The goal of the campaign was to improve the mental health well-being of adults in the UK. A survey by Public Health England discovered that 8 in 10 people have experienced early signs of poor mental health. This showed the need for advice on how to improve mental health well-being, especially at the start. I think this campaign does achieve this with free mental health advice, easily accessible on the app and online, and also use celebrities to raise awareness of this at the time. There is limits to this campaign. For example, high engagement is needed. A person who is suffering from depression and anxiety may not actually have the motivation to go online, fill out a quiz, and then follow the action plans, especially as it's very individual based and the person has to do it themselves. There isn't a health professional there helping them and encourage them to do so, whereas there would be maybe in CBT therapy or if someone was in a mental institution. They may have lack of motivation to do anything at all. The individual has to be actively engaged. A person also needs a supportive environment to do this, which they may not have. Also, it focuses on self-help and equipping the person with the tools to improve their well-being. However, it cannot help someone with wider issues, such as if they're unemployed, if they have bad houses, other social and economic issues, such as that we saw earlier in the ecological model. These factors are ignored, and they can unfortunately have a huge impact on someone's mental health. Therefore, it is limited in how much of an impact it can actually make. Also, I think it's not a replacement for a mental health professional. It's more for someone who's maybe experiencing early mental health issues or someone that just wants to improve their own mental health well-being. Someone with more severe depression, psychosis, schizophrenia, this wouldn't be helpful for them. There is strength in this campaign. For example, early intervention has been proved to be positive and to help someone stop their mental health becoming worse. It's become very effective and also saves the NHS millions in services a year. A study from the British Medical Journal found that having early intervention services improves outcome for patients and could save the NHS £33.5 million a year. This quote is mainly about people with psychosis, however, it is still very relevant. This quote from the study said, "We have now shown that each person treated in an early intervention service is twice as likely to become employed and 50% more likely to go into stable housing compared to people with early psychosis who are treated in other services." Having this support online and accessible for people who are starting to experience mental health issues could prevent problems from becoming more severe and save the NHS money in treatment. This also follows the health promotion model, which looks at preventing illnesses before they happen. Another huge strength of this campaign is that as it is run by the NHS, it is free and personalised support. There is no financial barrier for someone to access this service. For example, it's just on the internet, so therefore they could use their local library to access it, or if they had a laptop at school, it is easy to access online. Which, for example, there's a barrier for someone accessing help. For example, they may not be able to leave the house, therefore they can't get to a GP, but they can log on online and look at this advice. Another strength would be that it is actually quite personalized support. An individual will use the quiz to get their own personalized mind plan, which then gives them personalized advice. As it also is an NHS campaign, everyone in the UK knows what the NHS is and have confidence in them. Therefore, they will be able to trust the information that it gives. So this campaign was actually launched by Public Health England. However, since then, that has been replaced by the Office for Health Improvement and Disparities in 2021. So it is now run by this. This was set up to help improve England's health by saying they would focus on tackling obesity, improving mental health, and promoting physical activity. It works alongside local governments, the NHS, and communities. The goal of the department includes prevention of reducing illnesses before they develop into something more serious. Prevention reduces the risk of developing a serious disease. An example of this is the diabetes prevention programme by the NHS. Type 2 diabetes is preventable, and there are 2 million people at high risk of developing type 2 diabetes in the UK. The Health of the EU NHS diabetes programme has resulted in a 7% reduction in new diagnosis of type 2 diabetes. This is a success of the department, as fewer people developing diabetes reduces the need for long-term care in the NHS, and then the NHS can focus on services that are for unpreventable diseases, for example, diabetes type 1. There is limits of this department. For example, 80% of people's health outcomes are due to other risks such as housing, education, and lifestyle. Therefore, even though the department can run campaigns that encourage healthy lifestyle changes like the Couch to 5K running app, quit smoking app, the Start for Life, which helps new parents and new babies have a healthy start to life, they have limitations on how much change they can do and have to work with other local governments or other departments of the government to help implement changes. However, I do think that in conclusion, despite the limitations, the work they do and the campaigns they have an overall positive impact on the population. They just need to work in conjunction with other departments. And these are my references and images references.